Today, we are going to take some questions that some of you have sent in. We gathered a few of them. Want to shake it up and just draw one randomly out of here. And what do we have? Okay, so these questions are basically just random questions you have about chiropractic that people have sent in. And this one is asking, I've heard that when you go to a chiropractor, you have to go for the rest of your life. Okay, I've heard this one before. Is that true? Well, to answer the question, short answer, no, that's not true. You don't have to go to the chiropractor the rest of your life. Technically, you don't have to do anything if you don't want to. Even if you have somebody pointing a gun at your head, you don't have to comply with what they say, but there are always consequences to every action. Doesn't matter if it's a good decision or a bad decision, you always have consequences to those decisions and actions. So, for example, if you don't go to a chiropractor, you don't have to do that, but you're going to pay the consequences of spinal decay. Arthritis is typically how people learn about this, and they may learn about it in their 30s, 40s, 80s, whenever, but it will develop if you have damage in your spine. And when I say damage, it just means the joints don't move properly. So when the joints don't move properly, they start to break down in as little as 4 weeks. It's microscopic. That can be fixed. Not a big deal. When you get into 4 months, then you start getting scar tissue developed around and tightness in the muscles and things like that, where the spine starts to shift and bend, and you develop compensations at this point. When that sets in, it takes longer to fix. So you got to break through those adhesions. You got to work through the compensations to get the spine to work properly again, to get the best function as you can. And if you leave it for decades, now you've got degeneration, which is what most people call arthritis. I'm going to be picky here because arthritis means inflammation in the joint, and you can have osteoarthritis and rheumatoid arthritis. And I'm going to be picky here. The term arthritis just means inflammation in the joint. You can have osteoarthritis, you can have rheumatoid arthritis, and you can have psoriatic arthritis. So there's 3 common types. Now, the most common is going to be osteoarthritis, and this is going to be the wear and tear that you get in the joint from improper movement over time. So this is what most people see when they go to the doctor and they say, oh, I have arthritis. Well, guess what? Depending on how bad that degeneration is, so degeneration is going to be set in stages. You can have type 1, which is completely reversible. You can have type 2, which depending on how far you are along with that, you start seeing the decrease in the disc base at that point. It's much more evident. You start seeing the early stages of bone spurs setting in. Some of that can be reversed, some of it not so much. And then you get into stage 3, which we just try to slow down and keep from getting worse. Some of it might be able to improve a little bit, but most likely chances are it's been there 30 years or you've had a massive amount of damage and you're not going to fix a whole lot of it. Again, you just want to keep it from getting worse because it can still get worse. So then you can get down into stage 4 where you're pretty much almost fused. And at that point, there's really not a lot that can be done. Again, trying to keep the joints above that aren't, or even below that hadn't become that far degenerated, that would be the goal at that point. So what would you have to do? 1, fix the issue. You always want to fix the issue if you have an issue, okay? Whether that be pain. Pain's very simple as far as it's going to be any kind of symptom for that matter, but symptoms are the last thing to show up. They're the first thing to leave. Doesn't mean the issue's fixed. You want to fix the issue that's causing the symptom. And if it's been there for decades, it's going to take longer to fix. If it's been there for a couple years, not as long to fix. So do you have to go forever? Short answer, no. Do you want to get that fixed? Well, I mean, I certainly would. I want to fix the issues I have so I don't have worse issues down the road. And whenever you get it fixed, that's when you have the decision to make of, do I maintain it or do I just disappear and leave it be? So if you leave it, you get into what's called the law of entropy. So basically, entropy is you don't have to do anything. When you leave something alone, it tends to decay and get worse. And so if you want to improve something and continue improving something, then you get into the law of intention. Law of intention means you put intention and you do things intentionally to build something up. So to build it up and to keep things maintained, you have to have intention. To let it decay, you don't. You just do nothing. It literally will start to fall into entropy at that point in time. And again, that's the choice you're faced with at that point in time. So do you have to? No. Is it a good idea? Absolutely. As long as you're breathing, as long as you have a spine, as long as those joints are still moving or capable of getting motion in, it's always a good idea to keep going to the chiropractor to keep it healthy. But again, nobody's forcing you to do anything. And even back to that situation, if you have somebody holding a weapon to your head saying, you got to do this or I'm going to unalive you, you have a choice. Maybe not be the best choice in the world, but you have a choice. You always have a choice, guys. All right. So hopefully that clarifies that answer. If you have more questions, feel free to send them in. I will put them in the list in the bucket, and we will shake that up, and hopefully yours will be the next one read out.